Good morning, everyone. If we could all please take our seat. I believe we're now live online, the room, and those online. My name is Evelyn Nakota. I'm the Cabinet Member for Health and Wellbeing, the Chair of this committee, and also Vice Chair of Partnership Southwark. And I'm going to go around. I'm going to start with yourself, Nancy, to introduce yourself.
Thank you. Hello, everyone. I'm Nancy Kusherman. I co-chair Partnership Southwark Strategic Board with Evelyn and provide clinical leadership in Southwark.
Hi everyone, I'm Councillor Jasmine Ali, Deputy Leader of the Council and Lead Member for Children, Education and Refugees. Good to see you all.
Good morning, my name is Hakim Oshnaki. I'm the Strategic Director of Housing for London Borough of Southwark.
Good morning everybody, my name is Ali Richards. I'm the Strategic Director of Environment, Sustainability and Community Safety and Leisure.
Nearly forgot leisure there. Hi, I'm Darren Summers. I'm the Strategic Director for Integrated Health and Care and Place Executive Lead for Southwark.
Morning, everyone. Sangeet Leahy, Director of Public Health.
Morning, everybody. Chris Williamson, Assistant Director for Public Health.
And Louise Stark, Chief Executive on the clinical groups at Guy's and St Thomas's.
Councillor Maria Linfors Hall is proposed for the opposition. Thank you.
Good morning, I'm Raman Kalar, Research and Projects Officer at Banks Pab.
Thank you. I've decided that you officers have your titles are way too long. Way too long. We have to do something about that. So thank you for everyone that's here. I'm going to read now apologies. And I have apologies from David and Alistair. Just to say, I know Ofsted are in now, so some of our officers are very busy with that. So I wish them all the good luck on that. I have apologies from Mahmood, Peter Babudu, Ade, Cassie, Althea and Rihanna. Now Rihanna's got a placement, so thank you for that. Before we go on to the agenda, and the agenda is going to be really interesting today. The bulk of it is going to be on neighbourhoods. And I think it's a great place for us in how we shape the IMTs into the neighbourhood work that is coming forth. And this is a pivotal point because this is going to change how we do kind of neighbourhood working, how we work with our partners, the NHS and the council. And our partnership work is really going to be tested by the IMT. So this is an opportunity for all of us to be involved in a discussion about how we align ourselves, because I know that the council is also working on neighbourhoods. There's neighbourhood coming from the NHS. So how do we align that work so that we get the best out of this going forward? But before we go on to that, I am going to make two announcements. So I note that CQC have gone in to inspect SLAM and also Kings, and the results requires improvement for both, so it's rather concerning. I would have liked both organisations to be able to kind of respond to it, but we don't have them present, really. And Philippa, I'm not going to come to you for that because I think it would be unfair. So what I propose is that we have this on agenda for the next meeting so that you can respond about how you're responding to the concerns raised in the reports. I think it's really important that we have an eye on it in Health and Wellbeing Board. So thank you for that. So there has been no any business of urgent matter that I deem urgent. Does anyone have an interest or disclosure of interest and dispensation? Nope. There has been no public questions, so we move straight on, I believe, to the joint health and wellbeing strategy, and I'm going to call Rosie and Alice to the front. It's going to be just you and Rosie today.
Yes, it's just me. Apologies from Alice, so thanks to her for pulling these together. So joint health and wellbeing strategy, as you know, we already have a strategy for the board in place, which takes us to 2027. Just to draw attention to our duty as a health and wellbeing board, so the Health and Care Act requires us to take a lead on developing the strategy, and the NHS 10-year plan also asks us to lead on development of a neighbourhood health plan. Currently, there's only informal guidance around that, and the formal guidance has been sort of delayed until autumn. But we have some ideas about how we could still work on that together. So our proposal is that we have a new 5-year health and wellbeing strategy developed to cover the period April 27 to March 32, and that the neighbourhood health plan that's developed this year is added as an addendum to the current strategy and then incorporated into the next strategy once published. And we'll have to work closely with Partnership Southwark in the public health team and the neighbourhood health integrator to really ensure close alignment. Just a little bit more on the structure proposed. So in the strategy itself, which we could publish separately from the action plan at a slightly different timeline, we'll incorporate the vision and aims as well as the neighbourhood health strategic plan. And under the action plan, we've proposed the same thematic areas as used currently, which includes healthy neighbourhoods, which we can take a more explicit look at how we work together across those neighbourhood priorities. We could have slimmer number of themes. We can be adaptable. I know we want to stay as focused as possible. We've currently been using a drive, sponsor, observe approach, which I think the board has found particularly helpful at narrowing our focus in terms of the actions that the board specifically has responsibility for, so we propose to continue that. The sponsor and observe actions may be actions that the board or others not on the board have a role for but are still relevant to the board, so we could still bring in items for the board to consider as and when needed. And just a note on the actions that the board would have oversight of. So we really want the board's actions to be new and innovative, to focus on where that collaboration is really important across teams and organisations, to be smart and to address needs that have been identified through the work, for example, of the JSNA and community engagement. There are two parts of the process that have been proposed. So the first being the scoping phase, which we set out for January to May 26. So we've already started doing some of this work, and really it's thinking about the needs assessments and the community engagement that we're doing, conscious that there's been engagement through SLAM and Kings and Citizens UK and Health Watch that we're mindful to kind of use the insights from as well. And we've also got for the board to consider some advisory boards that we should link in with, and keen to hear from you if there are any others that aren't mentioned, but we'll leave that for you to look at. The second phase of the process would be the engagement, and as well as the additional engagement that's happening already, we would also want to continue with the Health of the Borough events, which I think everyone has found rather helpful. We had one general one to kick us off, we had another one on housing, and we continue to take that sort of thematic approach to dig deeper into particular issues for each of the 5 themes. Other engagement to be decided, surveys, etc., but open to thinking with colleagues about that. So the strategy development would take place between this October and February next year, and really keen to work with partners around the table. Scoping and engagement findings would be presented to the stakeholders and the advisory boards referenced and further refined. And the idea is that we would sign off in March 27. In terms of the action plan, like I mentioned, this could be done separately. So proposing January to May with a slightly later finish for the action planning, and that would review our best practice and literature to shape evidence-based actions, and really focus on that engagement piece with stakeholders. So just to conclude, the recommendations are that the board approves the development of the strategy and the recommendation to integrate Southwark's neighbourhood health plan into the strategy, with a recommendation being subject to change as the national guidance and frameworks are published. Thirdly, to identify any engagement work that may be being delivered or planned that we could use for insights. Mentioned some of those already, but I'm sure there might be more in the pipeline. Comments welcome also on the appropriateness of the proposed advisory boards. And finally, an invitation to each Health and Wellbeing Board member to identify an organisational lead that can be our point of contact for the development for Alice and ourselves to work with.
Thank you, Rosie. I'm going to go back to the beginning. I'm going to take it very, very slow so we can follow what's happening here. So our current strategy ends next year. Right now we've got a 2-year action plan. So this paper is proposal for the new strategy,
Yes.
which will start next year. So first of all, the recommendation is to approve the development plan, which you've listed out how we'll go about the development plan for 27-32. So I want to stay with that. Can you just highlight some of the development proposals you want us to kind of chip in and add to it so that we can follow on with the recommendations?
So I think there's an important point about the neighbourhood health plan, and as that develops, being agile to incorporate and be reflective of that work, particularly within the healthy neighbourhoods theme. We have identified those 5 themes as on the slide shown, open to that being changed, so welcome any thoughts on whether there should be fewer or different thematics, topics. We've kind of taken those topics because that's the language and the prioritisation that's used in the system currently, but conscious things could change with different consultations, so really happy to kind of be flexible on that. And again, I think the point about engagement, being live to the insights that are coming forward and really pulling that out together, it may be that we could have some separate workshops behind the scenes to do that once we've identified some leads. Does that help?
Yeah, it does. Okay, I'll come to you in a minute. So, I mean, we're thinking about the themes for the next strategy. Your thoughts about whether we maintain the themes that has been listed here, or actually is there anything emerging that we want to add? Also, a question about, do we narrow it down a bit more, make it a bit more slimmer and sharper, or do we carry on with the bulk of the themes? And also the consultation. I mean, it's really important that we consult, but we don't want to over-consult because I think we've got a breadth of information already there. But I think the Health of the Borough events really draw out a lot of information, not from just our partners, but also from our residents. So these are the questions, and have a think. My question also, obviously, when we start the consultation, will we be doing a JSNA at that point, to just kind of see what emerging themes are coming on? I'll come to Chris in a minute, but let me start with Darren.
Yeah, thanks. Look, I think we're in a slightly difficult position, and we just need to be honest in terms of where this kind of long-awaited national guidance, and it refers to it in the paper that at least 2 pieces of guidance. Actually, there's a number of other pieces of guidance as well that are expected, but the model neighbourhood health guidance and the neighbourhood health partnership framework for health and wellbeing boards were both due to be released in the autumn, and we haven't had them yet. And we keep on hearing they're imminently going to be released, but I suppose I'm going to be honest, you're losing some confidence on how imminent that is going to be at the moment. And I think what Rosie's proposed is very sensible, but recognising that when the guidance does come out, it could shift us in a slightly different directions. We just need to be we need to be aware of that. I think in the absence of that guidance, on a number of levels, it's again very sensible that we get on with our plans. Let's not wait until it comes out, because it shrinks the time frame we've got in which to develop our future strategy. We'll talk in the next agenda item a little bit again about how we're not waiting for guidance in order to start delivering a more operational level neighbourhood health or neighbourhood health and care services. And in fact, one of the points in here, point 14 in the paper, it says we need to do 6 different things. At least a couple of those are done already. So we are moving in advance of some of the guidance being formally published. I mean, again, just to add to that, so I think I saw an earlier version of this paper that talked about the Better Care Fund being renamed. And then the Better Care Fund guidance came out, and we've been hearing for months, it's going to be renamed as, I can't remember what it was going to be renamed as, and then it comes out, and it's not been renamed. So it's back, we're in the Better Care Fund. And so just that slightly difficult position that we need to be getting on with things locally. And I think there's a really sensible approach to how we're going to go about developing the strategy. But we could, when a guidance does come out, it could push us in a slightly different direction. The only thing I just think we should be wary about is, and I'm not quite sure, it could just be interpreted in slightly different ways. It's not, is about having sort of separate health and wellbeing strategies and neighbourhood health plans. And when I saw those 5 boxes, the healthy staffs and other things, then we've got healthy neighbourhoods. And I'm wondering whether a healthy neighbourhood is the kind of delivery mechanism for some of the other areas that we're talking about. So I just think that needs some further consideration about making sure that we don't have 2 separate plans, or the one seen as an addendum to the other, but it's developed quite separately, and then we're looking to sign them off. But actually they're really integrated, and we think about, essentially, it's basic concept. Neighbourhood health is bringing healthcare much closer to home for people, closer to where they live, and so how is that integrated into the overall joint health and wellbeing strategy?
I think that's an important point. I mean, I honestly, for the life of me, with the various strategies around, I just get so lost. So if we can at this point, I think we're in a very good position. If we can try and align it as much as possible and work together, I think that would be really easy, not just for ourselves, but also for our community to understand exactly what we're managing here. I'll go to Chris.
Thank you, Chair. I guess just building on some of the comments so far, I think to your point around the joint strategic needs assessment, absolutely. So the team are looking to refresh that, the annual report we do as part of that, and align it more closely to these themes, so there's a clearer connection between what the needs and the issues raised by our communities are saying to the actual strategy itself, because I think at the minute they don't quite, there's some mental gymnastics colleagues have to do, I think, between the JSA report and the strategy. So that work is about to start. On the point around the neighbourhoods, I think the healthy neighbourhoods part, I think in our head, would be the neighbourhood plan element, but more than happy to look at the language on that so it's more specific and clear that that's the case. I understood from the LGA yesterday in a workshop that the guidance is due out early next week, although we've heard that before. But they did make the point that it is guidance, don't let it stop you doing what you think is right for your local area. So it will point us in a direction, but don't be constrained by it, was kind of their view. I guess one other point I'd probably make is the current strategy's got over 50 actions in it, and I think there's maybe something about underneath these themes and these kind of broad priorities, having a fewer number of actions so the board and partners can be more focused on what are we trying to deliver together as a partnership, rather than there's lots of things happening in the system. So I think there's probably a plea there from my side as we work through this process that we really hone down on quality, small number of quality actions rather than lots of action in the system.
Yeah, I totally agree with that. Nancy?
Thank you. Thanks, Rosie. I'm very much in support of this. I'm a huge fan of Drive, Sponsor and Observe, and glad that LGA are as well. So that's really good to continue with. And the 5 areas I agree with. I had a couple of other things. I agree that the health of the borough events have been useful. They carry on with those. The advisory boards, I was interested. The Good Start in Life board and the Start Wells sound very similar, so I was interested a bit about whether there's kind of duplication in our system that we need to take note of. But the thing I thought might be missing here was relating to what's described in the supplementary bit about the council's neighbourhood programme, because I wouldn't see where that comes through in your advice. whether there was a role for some more explicit description of that as part of the strategy. So we, as in kind of talking, almost kind of doing a geographical bit. So what do our people in our geographical areas say to us, and what priorities are we setting as a result of the programme and the funding and the kind of individual decision making, you know, around planning and things, because it's in a neighbourhood. Am I making sense? Something about the fact that there's an explicit bringing together of all the things within a geographical area. Do we need to amplify that for the strategy? I also wrote this down, and I know it's not immediately relevant, but I've said for a few, we don't have primary care as a provider as one of the partners on this board. That's not my role here. I'm here in the Partnership Southwark co-chair role, not as a representing GPs or further. So I did wonder whether, as again, a part of how we refresh the strategies, we do another look at board membership and wonder about that. And again, whether that the neighbourhoods programme I've just referenced from the council, where that is fed through the members of the board, is it through the existing council colleagues, or it is through Alid? Great, congratulations, Alid. Thank you.
Good luck, more night. Jasmine?
Yes. Yes, thank you very much for the report, Rosie. I think really just reflecting on some of the contributions, Darren's sort of health warning. I mean, we've had on the children's world, we've had our own long waits, you know, for the school's white paper and special education needs and disabilities. It's here now, and it's kind of saying all the things that we wanted it to say. So, you know, we can definitely, you know, continue on the special education needs path. I was just thinking really in terms of the development work and everything, and obviously we've got rising numbers. You know, we know, I'm not worried about, you know, maybe I should be, but I'm not too worried about the long wait for health guidance, because, you know, the thing that anchors us is precisely the work you're engaged in, Rosie. We know our communities. It does worry me, you know, the increase in special education needs and disabilities around our children. And I was just wondering how, you know, the strategy will reflect the growing numbers. I mean, I see it's a priority. And how we will work across all the organisations. It's such a shame we've got Ofsted in, well, more people are around the table, but I'm sure they would say the same thing. You know, your exam question, who are the lead in the organisations? Well, there certainly are enough represented on the Health and Wellbeing Board, so we're going to have to, well, my advice is to go wider, really. I know we want to work smart, but one of the things working, you know, with something as complicated as SEND is that, you know, a lot of the organisations can sometimes work against one another. So I think really we need to widen that, you know, lead person in the organisation. But, you know, any reflections on, you know, where you're going with the SEND part would be welcome. Thank you. And thanks for your amazing work too.
Sangeeta, you've been waving your hands for quite a while. Over to you.
Thank you, Chair. So I wonder, having approved this paper before it came to the board, I'm actually wondering whether we need to be smarter and whether we just need a neighbourhood health plan stroke joint health wellbeing strategy. Because my fear is we've got the same people having different conversations, and there's a real opportunity for the neighbourhood health plans to look at prevention and to look at how do we address the wider determinants, which we all know will then end up in primary care, secondary care, tertiary care, because we haven't addressed what really makes people ill. So I think I'm almost suggesting we go back to the drawing board, and I completely agree with all of the priorities, but I think that they all, if we're going to do neighbourhood health plans properly, they should be addressing each of those things.
I second and third that. Yeah, I think, you know, organic working. And I think this is really important because, you know, I keep saying we need to align closer. We need to align well. We need to start doing it now. So I think if we can do that, and I think not if, we are going to do that, I think that would be brilliant going forward. Darren, your last word to you.
Yeah, well, I just must say, Gita, she put it more directly than I did, and I'm really pleased with that. I think it's a great idea. Just for 2026-27, though, we probably do need this kind of interim arrangement as proposed in the paper, so there will be an interim neighbourhood health plan that aligns with the health and wellbeing strategy. We're not going to get it done by April, as I think is suggested in the paper, because we do need to wait in terms of what the content of that plan. That's not to say we're not getting on with a lot of stuff, but the content of the plan will be shaped by the guidance, and we haven't had the guidance yet, and it will just take a little bit of time for us to actually write up these things and test it with appropriate partners.
But correct me if I'm wrong, we've got the strategy until next year. So obviously, there's something in place where we can start working on that neighbourhood approach into that, and we can start working with that, the guidance, I think, personally.
So it's very specifically the requirement to have an interim neighbourhood health plan. So we are getting on with neighbourhood health planning and delivery of neighbourhood health services, but we will need to produce a document that is called an interim neighbourhood health plan, and that I just think realistically, in the absence of the guidance yet, can't be done by April.
So can I leave it with you all to go back and work together about how we take the next step? And I presume we'll come to the next Health and Wellbeing Board about our approach.
Yep, happy to draw that and bring it back.
Excellent. And is there any response to the questions you've heard?
Yes, I think with Darren's first question, I was thinking about where some of the operational healthcare actions might lie. Presumably there are other documents and governance for that, but maybe that's all to be considered in this new sort of proposal. And I think in terms of Jasmine's point on SEND, we talked about the JSNA refresh and bringing in more up-to-date kind of information. So I think it's all to be sort of considered there in terms of what the needs are. I think that's an excellent point there, and really happy in terms of working with leads that you identify for us to be working with underneath the board. So happy to kind of collaborate. Yeah, I think obviously Sangeeta's point sort of gives us something meatier to work on for the next phase, so we can bring it all together into a tighter package.
That would be brilliant. And can I also just emphasise that what we're doing is not for ourselves, it's not to make our particular organisation give us less work, it's for the residents. So we are working together, making it more simpler so that the resident can get the benefits of it. So please have that at the point of your head when you're working on this, that this is for the resident, making sure that they have a simpler journey for the different organisations, and that whatever we're doing actually is tangible for them in the long run. Okay, great. Thank you so much.
Thank you.
Thank you. And now we're going to item 14. That's a Southwark Council Neighbourhood Programme, and I'll call on Farid. And Ali, do you want to say anything before Farid introduce?
Only said that the launch of the neighbourhoods model happened last year. It seems to be well received by residents. It's a good touch point for them. I think given the discussion today, there's probably an acknowledgement that we need to incorporate the integrated neighbourhoods model a bit more in there. I think the only time it was on the agenda was the Walworth Road, and we will try to put that as a standing item on neighbourhood forums, which I think the next one in the load of them is in June. After the elections, so we'll ensure that's a substantive item on the neighbourhood forums, because it was well received in the Walworth one. But I'll hand you over to Farid, who can probably explain this far more eloquently than I can.
Good morning, everyone. Lovely to see some familiar faces here. Good morning, councillors. Just a way of been asked to come do a presentation on neighbourhoods and give an update where we are with the programme. So I'll just crack on. So the vision around the Southwark 2030 was around to create a borough thriving of neighbourhoods that are fair, green, safe and shaped by people who live there. And the mission was to empower communities so they can shape their neighbourhoods and their priorities and feel connected within their neighbourhoods. And I'm just going to go on my presentation around what we put in place around governance, engagement, and comms. So why neighbourhoods matter? That was the question that we started off with. I think we agree many issues affecting residents are best addressed locally. People experience services in places, not systems. Communities have insight, assets, and solutions. Quite often, as council, we think like we introduce programs and we know the solution, but often it's bottom up. So I think that's why communities matter in terms of the neighbours program. And neighbours working can support prevention and early support. In terms of saying neighbours, sorry, the map's not probably as big as I was wanting to look on the screen. But as you can see, there's 10 neighbourhoods in the borough. Each of the neighbourhoods are either 2 wards or 3 wards, apart from the borough and London Bridge. That consists of 4 wards. And that's not a decision by officers, by the way. So. In terms of the neighbourhood makeup and electoral wards, you can see on the screen here. So, for example, Old Kent Road is a neighbourhood on its own because of all the issues and challenges in that area, I guess, and a lot of regeneration and programs are happening in that particular area. And so the decision was made to keep Old Kent Road as a separate neighbourhood on its own. Barrow London Bridge, for example, we've got Barrow Bankside, London Bridge, and West Bermondsey, St George's, and Kew. So that's the biggest neighbourhood area in the whole borough. And we also have elected councillors who are neighbourhood champions for each of the neighbourhoods. So David Parton, for example, he's drawn the short straw, I guess. He's got 3 neighbours to cover. Emily Hickson, she's only got 1 neighbour because of the size of the neighbourhood area. And Andy Simmons covers the south. And in the middle of the borough, Councillor Dora Dixon-Fowl. What have we been doing? So we've been introducing the neighbourhood community meetings. We've had 3-4 rounds of meetings now. The last ones were last night. And embedding neighbourhood champions. So there's 5 neighbourhood champions. They have 2 areas each, apart from those 2 councillors I've mentioned. We invested 3 million into the community. This is not new money. This is the existing Cleaner, Greener, Safer Neighbourhoods Fund and Devolved Highways. The decisions were reached last night in some areas, and night before, and on the 3rd of March was the first round of meetings that we've had. In terms of presence, we're trying to have officers being coordinated in a way that we are effectively being more present in our neighbourhoods. And I think we'll have to do a bit more work with local other departments to make sure other departments are playing in the same role and actually recognise the boundaries and borders. And public health has been great. And I've been working really closely with Chris in terms of getting their profiles and other things that have health profiles to embed in our community plans. And engagement, again, it's not just the people attending our meetings. How do we reach out to people that normally don't get traditionally involved in the council meetings and programmes? Is having those voices heard and then co-develop local priorities with the voices that we hear from the communities. And the community plans, I'll just go comment on that, it's basically part of the Southwark 2030. We listen to people, what they said in the priorities as a borough, but we try to make it a bit more local. So we did 10 neighbourhood meetings at the beginning of the journey back in September to make sure that people's voices are heard at a neighbourhood level, and then that's reflected in the community plans. We had 1,500 responses in those surveys, and that's a really good benchmark to identify what the priorities are. So these are the community plans at the moment in very draft form. We'll obviously be listening, looking at what people have said in those consultation exercises, and then that will be reflected on those community plans. So there's 10 neighbourhood areas and 10 neighbourhood plans individually. And in terms of engagement, obviously my officers in my team are doing the face-to-face engagement, but also we're having a bit more online presence. So we have a quarterly newsletter that goes out, and that talks about local events and activities, gives profiles to local organisations, but also it gives the area, the neighbourhood area, in terms of what the community safety issues are, the environmental issues are. Aled came along to the second round of meetings and presented some of the findings, and I think that was well received from the community. But we also have an Engage platform on the Southwark website, and each of the neighbourhood have their own dedicated page, and that talks about the area, the character, the history of the area, and the key events and activities happening in those areas, and anything that we need to publicise with the council, whether it's a neighbourhood plan or a health plan, those can go into those as well. We can talk about that going forward, Chris. So some of the themes and attendance figures, so for example, just as a guide. So far we've talked about, say, local priorities, and that was around to shape the community plans. We talked about community safety and environment, regeneration, and funding presentations. And so attendance figures for January, for example, I didn't have the figures for the March random meetings, but attendance for January meetings, you can see they're quite well attended. So again, because this was a funding pitching meeting, people come along to present their ideas. It always helps to generate people and it's enthused. Yeah. So in terms of the program, what does success look like? I think is we feel like it's if residents feel that their voices are being heard and they're involved in the process. Community priorities shape local action. Funding investment supports community-led solutions. And services and partners work together more effectively at a neighbourhood level. I think that's something that we have to be ambitious about, and making sure other departments and services are aligned to that, and how we bring them in to more effectively working together. Because sometimes we can work in various silos, even within council. Alignment of health plans. We have a shared neighbourhood focus, common population with health priorities. An opportunity to align plans, data, and engagement. Like I said before, we work quite closely with Chris and then trying to get the area profiles and demographics and other things that really helps our community plans. And finally, just I'll leave with that slide, questions for the board. Where will alignment add most value for residents? How can neighbourhoods community plans support health outcomes? And how can community voices be strengthened across both programmes? That's it.
Thank you. And this gives a really good snapshot of where we are with neighbourhood work. And I think this is a focal point for us to think, especially those that the integrator, about how you align or how we align actually as a collective with the work we're doing. And I'm just thinking about the neighbourhood plans that were created. It's not completed yet, is it? So it would be good to have something about INTs within the neighbourhood plans. And I'm not sure exactly, it's about timing, really, when are we thinking about finalising it, actually?
Yeah, so we'll be working on it now. So we're hoping to get this before May. So we'll present a final version. I mean, it's never a final, it's a work in progress in terms of priorities and others will change at the June random meetings, so people can see their input has made a difference and then it's been captured. But I guess both plans should be talking to one another.
100%. Louise?
Thank you, it was really helpful. I was just going to support that conversation. I think if we don't, we're missing a trick, but B, actually, we're not lining up what we should be lining up. So I think if we want to be efficient and give the best for our community, we should absolutely need to be aligning these two agendas because that will support the needs of what our communities need.
Yeah, just to, there's been some lessons learnt, isn't it, for the neighbourhood forums we've had so far, because probably isn't surprising that the vast majority of residents' community safety was quite one of the main issues. So when the presentations we did, it was community safety heavy, but there is a challenge in order to actually expand that from a community safety update to include integrated health, to include all the other services in the council, and that would be the next step. I think also what's important, while it was community safety, there was divergence in London Bridge. It was predominantly planning. And there are some neighbourhood wardens we managed to engage with a lot more diverse in terms of age and ethnicity. Rotherhithe was a good example of that, where we actually got quite a lot of young people involved, which didn't happen on the others. So there's still a lot of work for us to do in terms of engagement to actually try to hit those hard to reach sections like young people, maybe the Latin community, in order to get them involved, because we don't want to be in a position where the neighbourhood forums is the same old residents who turn up every time. We need to be a lot more diverse in terms of age and ethnicity, and that's our next challenge. So the first round, or the second round, went really well, was very well received, but it did feel a bit like the old community council meetings, but it's bigger than that, and that's our next task, is actually to extend it to incorporate all the other work streams of the council.
I mean, so the first request I would say for the draft neighbourhood plan, if we can have even just a summary of INTs within that is a precursor to us getting the fuller information when it's available. I will say the reason why I think things like health hasn't really come up is because it's just about socialising what we're doing. I don't think we have socialised INT. I don't think a lot of people know exactly what's happening, hence why there hasn't been a request. I do think this will be the venue whereby we socialise INT and the work that has been happening with our residents. And that is where we filter through to the community. So I think when you're up and ready, I think that the next phase will be going into the community meetings, neighbourhood meetings, and then talking about the INT and what has been created within the community. So I think that's the best thing. When we did a section on SLAM, actually, on mental health, in the Woolworth meeting, which went really well. Actually, people were really interested, and it was different to the normal kind of council update. So I think it will catch on, but it is about the steps we take. So make sure that when we're ready, INT and where we are with it comes to the next neighbourhood forums. Nancy?
Thank you. When we had our Health and Wellbeing Board Development Day, 6 months ago, I wrote you an email, Chris, that I deleted last week. It was a draft saying, what would it be like if we had mini health and wellbeing boards in every neighbourhood? And this is beginning to show that your thinking my thinking is never got shared, but yours already caught up and overtook it. There's something for me here about what residents understand as the needs of their neighbourhood. So not just what they perceive, but what their local residents need, and what the people who make decisions, what they also understand and how they use that information to make decisions. Coming around that shared knowledge is so valuable, and it helps everyone participate better, on both sides of the decision making. At that development day, we heard about Liverpool, where everybody knows that Liverpool's Health and Wellbeing Board's priorities is stop smoking. Do you remember that? And I was thinking again, how do we make sure that health in all policies messages gets through? And we kind of created some branding on that through our health and wellbeing strategy. So can we replicate that sort of approach in our community plans and our meetings? And the reason it's so important is these are the sort of things in my head, is planning on buildings that just, affect somebody's health. When a great big tower block goes up next to you, creates a wind tunnel, takes away your light, that has an impact on your health, but the people living in that building don't always know how they're going to participate in the conversation about that planning decision. Similarly, I'm loving the air quality report is on this agenda. That's my favourite highlight of the year. But actually, air quality conversations are so important here too. Low traffic neighbourhoods. Again, if you're able to present what you know about that environment and the needs of that population to the people who are there, then they participate much better in all that decision making and take more responsibility themselves. The final thing I'm going to say, I was at a patient engagement event last week to do with primary secondary care interface, which was trying to say to patients, how much would you tolerate going wrong in your pathway if you knew that the people around on both sides of the interface had done their best to help you? And they went, we put up with a lot. We would not mind our appointments being rearranged if there was a good reason. And that speaks to the bit you've just talked about, that health organisations coming into communities as well. We could use this to start to empower patients to understand how to use our system better, but also, when our system isn't perfect, what they can also take on themselves, or, follow up for themselves or fix for themselves.
Thank you. But I'm really liking the idea of us being very clear about what we stand for. I think the Liverpool example was really good, because if you go in the community, is that me?
Did I move my computer to?
They knew what the health kind of status of the, where they live were, and it would be really good for us to have a clear identity as a Southwark Health and Neighbourhood Board of where we're going to focus, what is the big thing, the big challenges for us. So let's think about that going forward. I've got a couple of names, and can I say, Philippa, Rumen, Hakeem, you haven't spoken, so I'm going to pick on you very soon. Prepare yourself. I'm going to go to Darren and then Jasmine Demaria, and then I'll come to you.
Thank you very much. It was really good to see the work that's been going on, and there's lots of really good work going on, I think, in this area. I think we've just recognised we're operating in silos, aren't we? So, and sometimes even within the council, different parts of the council operate in silos, and equally within the health service, we'll operate not as one unified kind of voice around things. I just want to push things a little bit more, to be honest, and think about where are the opportunities for further joint working. So I think the engagement and insight will be really important, and June's a good time. We'll have recruited our INT managers. We should start to be able to, and clinical leads, we should start to be able to field people at the community meetings that will be working in those neighbourhoods. That'll be really good. But there's something else I think that we need to think about, which is around what's our broader offer in neighbourhoods, and that's probably particularly from the council. So when we think about what are the wider determinants of health, so what really affects people's health, we know there's a really strong link between housing and health. There's a really strong link between employment and health. I could go on about the examples. So what are we actually offering? So we're going to be developing integrated neighbourhood teams, and some of the offer that's described in this paper we're offering in neighbourhoods. What are we going to be offering at a neighbourhood level for our residents? And if the answer to that is nothing for now, then that's okay. Well, it's maybe not okay, but it's good to get to a decision on that. And I'm not sure, because I think we're having some of these conversations about what it might be good to offer, but I'm not sure where we're getting to a decision around those things. And then just the other opportunity I wanted to perhaps talk about would be, and again an example is around estates, that we all have got multiple kind of shortages of estates and multiple buildings that are potentially underutilised, and that's a really good way to think about how we bring people together, by bringing them together around the buildings that we can utilise together. So
and before I go on, I think the question is, who's having these conversations? Who's around the table that can make decisions? So I think you have to decide, where is this happening? Because I think after this meeting, this has to happen. So you have to decide actually where we're going to have that strategic meeting.
Well, that was going to be my question. So I think we need to leave here with an action. So I'm happy to be the action on the health side. Who am I linking with on the other side? Sangeeta, Chris came to one of the GSTT meetings around employment and health. We need to join all this up.
Good. Jasmine?
Yeah, joining up, obviously that's the goal. But I did want to just give the benefit of some of my experience in this field. I think really when, more than ever, I mean, we're having a broad conversation, but, to state the obvious, it can only work this if it's bottom up, you see. And it's interesting because community safety is obviously, a big priority. But, in my lane and, the Peckham areas, we had this meeting where we had the creme de la creme of the police and everything. And hardly anyone turned up for that. There was more councillors. But then, just within 6 weeks after, in the run up to Christmas, there was, a terrible mugging. And then, we had to, as ward councillors, we had to organise a meeting because people wanted to know what was going on. And, we managed to get some police there, but nowhere near in such short notice, the star-studded crowd that we had. And it was literally in the same area, and yet people that were standing room only there. So, I mean, that's timing and everything, but maybe advertising and, making sure that we have, that word of mouth, just really spreading and advertising and marketing these events. The other thing I wanted to say is, I know that money is very difficult to mention, but, so we have these bids, and those, those attendance figures are around people turning up with their bids and then turning up to find out if they've got their bids, so that's quite a snapshot. We need to be honest about that. And a lot of those bids, I mean, I really recommend that you have a look at some of them because you'll be quite pleased. A lot of them are about health. We have basically health-related bids about mental health cafes, things like that in the community, intergenerational projects, all really good. They're not exclusively health, but, there's something to build on there. Obviously, it's very difficult because, this year, and it reflects the cost of living crisis, it was quite, it wasn't as pleasant as before because we had so many people competing for such, the same pot of money. But, well, you could see by those attendance figures. And if you're looking at 30 grand, 100 grand, and you've got all of that, with all brilliant ideas, it's a bit difficult, really. So we do need to, have a bit of realpolitik about this and think about the resourcing.
But actually, I've always thought that, it would be good if we had, say, a JSNA with information about our various neighbourhood, the health issues in the various neighbourhood, and throw it to our communities. Okay, what is your plan towards this? What would you like to do to resolve this? And then they can come to us and bid for the money, but it would be us providing the information that they can work on. And I think that will really go away in making sure that we are really targeted on what we need to do. I'm going to go to Maria, and then I've got Hakeem.
Very good report, but I think that there still is an awful lot to be done. I don't think we have done enough of engaging with the community. I think that the way of engaging with the community, you said that you have been successful in some ways in engaging with the community, but I don't think so. I think that a lot of people, a lot of the residents have an awful lot to say, and they are not questioned about it. They are not being seen, and they are not being given the chance to say what they have to say. And I think that the way of engaging is going to TRA meetings. Because if you go to TRA meetings, a lot of people are in there, a lot of people have a lot to say, a lot of people are very concerned about the neighborhood, and so it's the way of engaging. And any other meeting, any other public meeting, you have to engage with the community because it's an awful lot of things, especially the community safety at the moment is an enormous issue. In my ward, community safety is the prime issue. And the other issue that has come along recently is cocooning. It's an awful lot of cocooning. If everybody is old, there are people in the targeting. The other day somebody said to me, Maria, have you seen that guy that comes along to the building and is knocking on doors? And I said, yes, I have seen him. And they are trying to target me because they know that I'm old or they know that I live alone. And they just, if you let them in, that's it. You have it. Because they're coming into your house and they don't get out anymore. And it's one person in Elliott's Row who has been suffering for months and months and months, if not years. And finally, the police had to move her away because there was no other way of dealing with it. So I think engaging with the community is the prime importance, the prime issue, because there are too many issues to be discussed, including health. But not only health, it's community safety, it's other issues. Please, thank you.
Thank you. I think with engagement, I'll come back to you, Alid. I think with engagement, what we need to do is make sure it's varied, because I would say the TRA, you don't get as kind of diverse voices in the TRA meetings. So that is one aspect you can do. But I think when we did it Summit 2030, we had over 2,000, probably a bit more actually, people who got involved, who spoke about their needs, who spoke about the kind of areas of concern. That's one way. We've got an insight survey where we go out randomly to go to our community to also speak to them. That's another way of getting the information. So there's various ways. What we don't want to do is stick to one way. Otherwise, we will miss vital communities. So I agree with you. TRS are definitely one of them. Speaking to councillors, because obviously we speak to so many different residents, so we have a wealth of knowledge that we can bring forth. So that's another area. So yeah, thank you for that. And with cocooning, I just want to make sure, just in case you don't understand what it is when a vulnerable household is taken over by criminals. Yeah. And then they do their own kind of criminal exploits. This is something that we picked up actually when I was doing community safety, which is about, I would say, 8 years ago. So we have a cocooning board actually that looks into this. So it's something that, Alid, it should be on your radar. Okay? Okay. I'm going to go to Hakeem and then I'll come to Nancy.
Thank you, Chair. Obviously, working in neighborhoods is a good thing. This paper, it goes to lengths to talk about the positives around doing this. But my concern is that we provide other services across the council who are also locality based, but they are not based or aligned with these neighborhoods yet. So in housing, for example, and social care, it may not be possible to align with the geography, because council estates are not necessarily neatly spread across the borough. But we need to find a way to make sure that there are the teams working in those neighborhoods and in those at the very least.
I agree. I mean, the INT managers, I'm not sure what you call them, they should know in their neighborhood about housing, about social care, the key individuals. So again, it's about where we're going to have this meeting going forward. Nancy and then Ruma.
I was just going to draw your two comments together to do with the needs-led decisions about funding, because there's also our charitable funders, and I know through funding differently, which is Community Southwark have hosted for us, we've begun to match that need and what can be offered, but another place in which that conversation could take place is at Community Forum. And I'm reminded of the man whose name I've forgotten, who works with you about the linking community organisations with estates as well. Yeah, he's another key person to invite.
I think we really need a kind of a sit down, all of us.
Yeah, a workshop.
Some kind of workshop, and really map and work this out. So can I propose we do something like that after the election, where we come together and really map out how to organise this. I'm going to come to Ruma.
Yeah, thank you. Just wanted to kind of circle back to the point around community engagement and community voice. So Health Watch Southwark have been doing some work over the past few years on engaging underrepresented communities, so we'd be really happy to meet with the public engagement team to discuss best practice and learnings from that work. There's also, just on Councillor Ali's point around kind of getting communities engaged with events where decision makers are kind of going out into the communities, so you will know that there's a number of hustings coming up. Community Southwark is leading a hustings soon at the end of March, and part of that we did some engagement with community groups to figure out kind of what the priorities to take to the hustings would be. One of those was engaging with decision makers in a way that feels influential. So that will be a topic at that husting. So it's worth, attending that and drawing some of the learnings from that to inform some of the engagement that we're doing. So I don't think it is just about promotion. I think it's the way that you're doing things as well. And, to the point that Councillor Ali made, I think it's to be expected that you're going to get more engagement after a crisis or a point of, so that's to be expected as well. And then also just for the neighbourhood health plan, I believe, was there something around a patient and public engagement working group that was going into that? Or is that a different? INTs. Next one. Okay, no worries. Thank you.
Thank you. I'm going to draw this to a close. I'm going to be at the hustings, so be nice to me. The dates, is it 30? Is it 30? The end of March. So, yeah, so Ruma, if you can get that information, so it'll be interesting. So if you're welcome to come and hear us talk at that time. 27th of March, where would it be?
It's Jessie Duffett.
Jessie Duffett Hall. Okay, thank you. So I'm going to swiftly move on to, is this items going backwards? And now I left item 14, I'm going to item 10. I don't know how that's happened.
No,
so,
just so that they're aligned, so that
right,
kind of
okay, we'll rejig things. Okay, so I'm going to go to the INT work, and I'm going to call Darren, Louise, and Becca and Harpritz. Thank you for coming.
Are you ready for us? Should we get going? Yeah. Yes. So look, thank you very much. It's probably been a bit overdue, this item really coming to the Health and Wellbeing Board. You'll see there's a long pack in your papers with some very complicated diagrams. We're not going to try and talk through all of those, you'll be pleased to know. We'll give a relatively short introduction between us and then open it up to kind of questions and comments. Who's doing the slides? You're doing the slides, okay, brilliant. So, just to say that we agreed at Partnership Southwark Strategic Board in September 2024 that creating integrated neighbourhood teams will be would be one of our priorities, and we added it onto a priority. And we're going to explain just a bit how far we've come and the expected next steps in that journey. So we agreed that in September 2024. In the following year, so 2025, and I think it was May or June, the 10-year health plan was released, and the 10-year health plan includes priorities around what's described as 3 shifts. So the shift from hospital, from community, from treatment to prevention, and from analogue to digital. But underpinning all of that was a real emphasis on neighbourhood health and integrated neighbourhood teams that would deliver those 3 shifts. So we were slightly in advance in our thinking in Southwark of the national guidance that came out, as we've talked about in one of the previous agenda items, and it's on one of the following slides. We're now waiting for this further guidance to come out as well, the frameworks and the model neighbourhoods, and there's more as well that's listed. There's a whole new raft of different contractual forms that will come out for the NHS that will support neighbourhood health. And there's some estates guidance around creating neighbourhood health hubs, for example. So we won't list all of those, but that's all expected to get to come out. I just want to share this quote that's up from a GP, and I think it's worth kind of reading out. It's in terms of the journey so far. It says there's such a long way to go, but it feels like we've done 2 to 3 years worth of work in the last 3 to 4 months. And I do want to, and I will say at the end where we haven't done so far, but I just do want to kind of credit all the people that have been working on this, because we've come a really long way over a relatively short period of time. And I'm just going to take us a couple of examples from this. Is one of the complicated diagrams on the slide. You don't need to read it all, but just picking out a couple of examples on here. So as I said, we agreed it was a priority in September 2024. Later in 2024, we started our first frailty pilots for people with frailty in Walworth. By March 2025, we agreed the geographical boundaries for our integrated neighbourhood teams, and that was quite a complicated thing to do because it involved health services restructuring how they're currently organised to align with council neighbourhoods that we've just discussed. So now we have got aligned geographical boundaries for integrated neighbourhood teams and council neighbourhoods, which is really important in terms of those working together, breaking down those silos and starting to address the kind of wider determinants of health. By July, we'd appointed the integrator. Now, the integrator is one of those kind of words you think, what does that mean? But essentially, it's the kind of lead provider for our neighbourhood health services and integrated neighbourhood teams, and that's colleagues from JSTT in partnership with a newly formed primary care alliance for Southwark. In August, we were selected for what's known as the National Neighbourhoods Health Implementation Programme. So this is quite a high-profile programme that we put in an application for across Lambeth and Southwark. And again, given that kind of timeline, that we're really starting in September the previous year, we did really well to be selected to be part of that programme. And again, it was credit to all of the work that people have done. December last year, we agreed, and there was some funding agreed for the basic infrastructure of INTs, including the team managers that we've talked about, clinical leads, some of the clinical leads across what we'll talk about, different population cohorts. Those posts are now being recruited to, and in April we're going to go live. So actually, at the moment, we've been really planning our neighbourhood health services and integrated neighbourhood teams, but that is now starting to come to fruition. And from April, residents and patients in Southwark will start to see something different being offered to them. And so again, there's some stuff that's been missed out of that timeline. So, for example, we agreed at some point earlier in the year, I can't remember at what point in 2025, that we would align our newly commissioned home care services to those neighbourhoods as well. So we're starting to bring in some social care services. There's probably some other things that have been missed out of that timeline that are kind of equally important to that. I just said, before I hand over to other colleagues, there's some stuff I think we recognised that we haven't yet done. So this is primarily health focused at the moment, and not health focused across all everyone with health needs in the borough. It's been specific cohorts that we've focused on. We're planning to broaden that out during the course of the next year. So we'll be broadening out, for example, the offer to people with mental health needs and serious mental illness. There'll be a much greater focus on prevention as we move over the course of the next year. And the other thing I think was we've fallen down on, this has gone pretty much under the radar. You said it earlier, Evelyn, but it's not been brilliantly socialised. We've been working in a bit of a bubble about what we've been trying to create. And again, that we are, Louise and I were talking earlier, we will be looking to have a public launch of what we're doing after the elections. We've yet to set a date for that. We're really going to be looking to start join those forums that we've talked about to engage better with local residents, but also publicise what we're doing. So I'm going to pause there. I'm handing over to Monica.
So hi everyone, I'm Monica Sybil. I'm a GP and one of the clinical directors in South Southwark, and I was really just asked to speak to about what will be different for residents and for patients. And if we sort of think about neighbourhood working, I was going to focus today just speaking about a particular cohort of patients, which are patients with 3 or more long-term conditions. And really thinking about how neighbourhood working might benefit them. And the group of patients that we're proposing to look at through the model is patients with diabetes, with a cardiac condition, and with chronic kidney disease. The vast majority of those patients are well looked after in primary care in the normal way, but for some of those patients, their measurements are never quite what we would like them to be, and they bounce in and out of primary care, maybe using a disproportionate number of appointments, and quite often bounce in and out of our emergency services as well, and really sort of thinking about how a different way of working might support this group. So if you took your typical GP appointment, we would say it'd be about 10 minutes, your patient would come in with these conditions, and perhaps you would be discussing their symptoms, or probably some blood tests or a raised blood pressure reading that somebody had picked up on. And within those 10 minutes, you'd be sort of explaining why you were concerned about those readings, and trying to get the patient to sort of understand that, perhaps discuss whether they're taking medication, encouraging them to take medication if they're not, and if they are, then thinking about how we sort of increase medication to sort of get those measurements to where we would like them to be. With this new way of working, we would hopefully be having a longer appointment to start with for this sort of more complex group of patients. So they would have 45 minutes to an hour typically with a clinician to really sit down and kind of have a bit more of a holistic kind of understanding of that patient and their individual needs. I think education is really key. So patients understanding what their conditions are and why, as health professionals, we're worried about those conditions, particularly chronic kidney disease, which isn't always understood, and high blood pressure, which often doesn't have symptoms. So, really kind of taking ownership of, and then really understanding what the barriers to managing their health might be. So are there mental health issues? Are there social issues? Are there issues with employment, with childcare, with finance? Are there carers? All the multiple things that I'm preaching to the converted that we know might, create barriers for somebody to really address kind of their physical health needs. And addressing those barriers are obviously key to helping them move forwards. So how would we address them? We've got amazing primary care services that we can input into. So we now have mental health care practitioners who work sort of, with SLAM, with us, within our surgeries that might be able to provide psychological support. We have social prescribers that can support people with finances, housing applications, helping them understand what's available. We have health and wellbeing coaches, so people are overwhelmed with all the things that they need to do, sort of providing sort of more support kind of over a 6-week period, kind of helping people adopt more healthy lifestyles. We have kind of the wider team, our VCS colleagues that we can signpost into to really support people, embedding them into the community. And then through this way of working, we're also hoping to work really closely with secondary care colleagues. And that's a different way of working as well. So typically where we wouldn't know what to do as GPs, as primary care professionals, we'd either be sending off an email and advice and guidance, hoping for a response in a couple of weeks, or we'd be doing a referral, which may take months. In this new way of working, we would have a named professional, and we'd be able to say to the patient, actually, you know, I'm a little bit worried about the decline in your kidney function. It's been quite rapid over the last few months. I'm just going to go and discuss it with Dr. So-and-so next week, and then I'll get back to you, and we'll make a plan together. And that kind of, you know, not only instills confidence in the patient, they've got expertise, but also upskills the primary care workforce. So long term, we'll be able to manage sort of these more complicated patients better. We're also embedding care coordinators into primary care and into this model. And really, their role is a bit more hand-holding when you're sort of dealing with with patients who've got multiple conditions and perhaps quite complex needs. It's nice to have somebody, it's useful to have somebody that can help them navigate that healthcare system. So make sure appointments are attended, that actions are followed up, and that patients feel that they are important, valued. And the idea is really just to empower patients, embed them sort of back into their communities, help them take ownership of their own health, and so they can sort of fit in with, you know, their usual reviews, 6 months, a year, but have their conditions sort of better managed. So that's and I was just going to talk very, very briefly about a case study. So a patient that we had, a real patient, working age, male adult, who had high blood pressure, chronic kidney disease and diabetes. And his blood pressure was so high that he just kept on bouncing in and out of A&E. So multiple attendances with really raised blood pressure, feeling unwell with it. You know, medication was given, his blood pressure was lowered, and then it just the cycle would repeat. So he came into one of these sort of long appointments where we had a bit more of a holistic kind of understanding of what was going on for him. He wasn't really taking his medication as we suspected, and there was a little bit kind of in terms of medication, side effects that were unacceptable to him, and so his medication was changed. But the prime reason for him not taking the medication actually was that he believed his symptoms were due to stress, and his stress was causing him to feel unwell. And actually we managed to sort of find a VCS group that supports young black men, and him attending that group has not perfectly controlled his blood pressure, but has stopped him bouncing in and out of A&E. So we're a much better place than we were. And I think there are multiple examples of that kind of more holistic way of working, having better long-term outputs than short appointments or specialist appointments where well-meaning clinicians make changes and then they're perhaps not sort of embedded long-term. That's from me. Thank you.
So I'm just going to talk about the role of the integrator and integrated neighbourhood team. So it's Darren. The integrator is, I call it a convener, really, a bit of an organiser. And for Southwark, that is a combination of Southwark GSTT and Southwark Primary Care Provider Alliance. They send their apologies today, actually unwell. But the role is just to be a convener. So work together as part of a collaborative partners across to make sure that we're improving the pathway and making sure that we're being efficient with our healthcare resources. So the role is to lead the delivery of INTs, to support operational coordination, look at population health management, and making sure we've got the right infrastructure to deliver on this. So for Southwark, an example of the membership, we've got GSTT, obviously in primary care, King's College Hospital, SLAM, the voluntary sector, social care, public health. So it is a complete mix of providers in that space. So if you look at integrated neighbourhood teams, as I've said, it's got a mixture of partners, but this focus is really on the specific needs of the person, as Monica has alluded to. So we're being a more proactive way and helping people manage their health more at home and try to avoid hospital where possible. Now, not only will this deliver better outcomes but and reduce inequalities, we also need to find a more sustainable way of delivering healthcare. People bouncing in and out of hospital where the care is actually really expensive, it's not good for the patients, is something that we need to move away from, and this will help us provide better care in patients' homes. So we have got some challenges. We know that some patients with complex needs have chaotic patterns of resource usage, which is what Monica was alluded to. Patients have to tell their story many times, and that leads to, as I indicated, inefficient use of resources. The 10-minute GP appointment is often not long enough, and hence this 45 minutes will support. And as we've stated, we often default to medical interventions, and that may not be what is actually needed. Another example, one of our paediatricians gives an example of how we had a school child regularly not at school, really severe asthma. They went to patients' homes, there's mould all over the walls. Medical intervention was never going to solve that individual's healthcare needs. As Darren has mentioned, we are starting with a medically focused model for specific targeted cohorts, which I'll come on to, but we do want to move over time in the direction of bringing all this. So we have social care partners in the room, but actually we want to start joining up work across sectors, including such that it's already ongoing. How do we bring it in? And over time, we need to do more with housing, more with the wider determinants of health. We're already seeing some of that. So we are also the guys in St Thomas's are also the integrator in Lambeth. That brings efficiency in itself, because there will be things that are the same in both boroughs. We're talking with them, and we will do the same in Southwark, about using AI to predict, okay, who's going to fall, who's at high risk of fall, and how do we go in and prevent that from happening. So, and we've also, just to say, we've appointed a voluntary sector strategic lead for LARCE, who works with Healthwatch in Lambeth, to develop an approach to voluntary sector engagement across both boroughs. She's just started and will work to really help us drive that voluntary sector engagement even more. So just to go to the last one, so this is where we've targeted. So we have looked at all the population health data, and we're going to focus on the medium risk cohort. So those are patients that could potentially tip into that top part of the triangle, and where we think the interventions are going to be most successful and have the biggest impact. The cohorts that we've talked about, so Monica's already talked about the long-term condition cohort. The other one is frailty, so people about age 65 or over with moderate to severe frailty. And then for children, we already have the child's model, which has been very successful, but we're going to focus on children with complex needs between 0 to 18. And the other conversation we have agreed, and we agreed this recently, is how do we work with mental health? So SLAM are a big part of this, but how do we work better and bring in that mental health component, and patients with SMI? I think we probably need to do some work together around how that fits into the long-term conditions bracket, and how do we bring mental health as part of our cohorts altogether. So that is very much work in progress. We were discussing it at our first OD session that we had a couple of weeks ago, which was really, really successful with all the partners. So we are looking at clinical data, so we're looking at data from primary and secondary care to overlay onto where we need to focus. Interestingly, yesterday I had a conversation with LAS. They've got data that we need to overlay that on top again, and that gives us a really deep understanding of where we've got real health needs and where we need to focus in different parts of the borough. So I'm going to hand over now, I think, to Harpreet.
Hello, Lally. I'm the IT director within Southwark. So in terms of going forward, I think anytime, everyone will be well aware, anytime you are trying to integrate services, implement new ways of working across different teams, there are key challenges. So a key focus for the next 12 months is working through these challenges and agreeing what we can do in the short term right now, and then how we're aspiring to that longer term solution. Culture change is absolutely a huge bit. We keep talking about team of teams. The relationships absolutely underpin that. So we are very much thinking, how do we support that space for people at neighbourhood level to create those relationships? To the points made earlier, even knowing who the people are in the neighbourhoods, who they should be connecting with. So as mentioned earlier, the neighbourhood managers and the clinical leads, that's a key part of their role in the first 3 months, actively going out and kind of making those links and relationships. I think it's also about processes that make it easy to work in that way rather than hinder. So one example is obviously a shared record, so that, you know, people have access to the relevant information, you know, going back to that point about people repeating their story multiple times. We know information governance is often a barrier to that. So again, we're having those conversations about, from a technical perspective, what a solution could look like, but what's the IG that's needed to actually allow us to do that. I think information governance, like integrated data sets, I think is a key bit. As Louisa mentioned, we had to rely on health data to start with in terms of identifying the people that would most benefit from this. That provides an incomplete picture of kind of what, you know, the most in need people are in our population. So I think absolutely want to work towards having that integrated health and social care data set. So we're really identifying those people that we need to kind of reach. Also recognising that not everyone engages with services, so thinking about, you know, those underrepresented communities, how are we kind of reaching out to them? Funding and contracting is always, you know, a key issue. We keep talking about the central role of the voluntary and community sector. Key theme back is, how are you funding us to kind of increase our role in this in a sustainable way? And obviously the point about estates has been mentioned. How are we being creative in terms of use of our estates, both for supporting staff to work together, but trusted places that communities know and go to? In terms of, sorry, I'm switching around in order. So in terms of then the enablers, so as I've mentioned, we are doing various work on all the enablers that we need. So I've mentioned estates, as Darren said earlier, really keen to have a conversation with this board about how could we work together. The other piece, the resident engagement, is another key one, so it's fantastic to hear all the great work that's been going on. As has been mentioned, we've got lots of insights already, and then we want to be clear what the purpose of that is going forward and make that meaningful. So it'd be useful to consider how we could work together on these. There are lots of conversations going on both at Southwark level, South East London level and beyond, and even, you know, within organisations. So, you know, a key challenge is how do we effectively connect these things. Another key piece of work that we are doing is around kind of the, you know, what is this trying to actually achieve? Like ultimately, INTs are seeking to deliver improved outcomes for our population, making the best use of the local resources that we have. But how are we measuring that? So I think we're looking at it through 4 kind of key lenses, from a resident patient experience point of view, from the workforce, how does this feel? Is this just more layers? Is it actually helping and, you know, making it, you know, a better experience? Overall, are we improving those population health outcomes, detection, prevention? Are we reducing inequalities and not inadvertently exacerbating them with the way we're working? And as mentioned, how are we supporting that left shift from hospital into community services, both in cost and kind of the care, kind of the activity? We're very mindful that there's lots that sits underneath this. These are long-term outcomes, so we need to kind of agree short-term process measures that almost, are we on the right track? Are we going in the right direction? And I think it's really important that there be a bit of a co-production of the measures, because they need to feel meaningful and relevant to different parts of the system and residents. So in terms of lastly, I suppose just ending with, as mentioned, Darren has said that the INTs will go live from April. It's a starting point, and I suppose really emphasising that. As noted, the key focus for the coming months is really expanding that model to involve more people. So the neighbourhood managers, clinical leads will go out to talk to statutory, voluntary, community organisations, and I think from them develop that really deep understanding of what those local needs are, because they know, building on the insights work, but very mindful of the work that's already going on in terms of community outreach, community ambassadors, the work well, supporting people into employment, those relationships with housing. So that's very much the focus, and we'll just continue with, various other work across the year. So I'll hand over to Darren.
And just finally, so that we pose some questions for discussion. Actually, a number of these have been raised already, so I don't need to read them out again, because we've talked about how we work together across the kind of wider public sector and potentially beyond that to maximise the benefits of neighbourhood working, particularly around the wider determinants of health. There's a question there around health inequalities, question around system barriers around estates and digital, and then there's a question about resident involvement and engagement. So I don't need to read all of those out, but of course people are welcome to ask other questions or focus on other areas, but these are the areas we thought it was useful to focus on.
Great. I mean, it's a really in-depth presentation. Monica, thank you for that example, because that really brings it to home, what we are and what residents should be expecting. And I think that's really important to be able to socialise that aspect with our community so that they understand as well. So I'm mindful of time. I'm going to open up to three questions. And then we'll wrap up. So I'll go to Sangeeta and then Philippa.
Thank you. Thanks for the presentation. And I have, of course, been privy to these conversations before. It's still really helpful to hear the case studies each time, because we've got to keep remembering it's about our residents. I am really interested, of course, is then, because this is fantastic, but then how do we scale this up to our population? Because there are a lot of people out there in need of services, and I don't expect you to answer that now. But just in terms of an unanswered question from Louise earlier about who's the council lead, and your request, Chair, that we have a session to just sort of map out and think through lots of different issues. My suggestion is actually it's Health Wellbeing Board who organise a session rather than the council, neighbourhoods or the integrator, because I think we are the board who is bringing the system together. So can I propose a closed development session after the elections to thrash some of this through, to look at how we working together? Thank you.
Thank you for the presentation. Obviously, I'm privy to some of it because I've seen some of the papers from your other meetings. But I guess my comment is obviously going to be a bit SLAM focused initially, but I do have a broader comment to make. Many of you may be aware that SLAM is currently realigning the mental health teams to your inter-neighbourhoods, so that will automatically allow that integration in the future, hopefully. Obviously, there's, as you said, lots of work to be done on how the teams work together. I guess listening to your focus areas, which again I was familiar with, I'm just mindful that's probably not in the room, is the voice of older adults from a mental health perspective. So these are the teams that carry people over 65 with serious mental illnesses and or deteriorating dementia. So I think it's probably worth thinking how they align with your frailty cohorts, because they will be in there and perhaps have a greater inequality because they're possibly not accessing the help that they need. And then with the SMI work, I think we need to think about how we don't duplicate, because we already know with primary care we duplicate on SMI health checks, and we don't because we can't compare the data easily. We know that people are probably getting checks in two places and then some people are not getting a check at all. So we just do really need to think about how we stop some of that duplication. But at the same time, how do we support patients with really serious mental illnesses who are at much higher risk of developing a long-term condition, actually, to access that support much earlier in the pathway, because they often get diagnosed quite late in stage. So that were just my comments from a SLAM perspective. And just a broader perspective around the inequalities, I just wondered, and it's sort of a conversation I had with Sangeeta when we met recently, is how do we capture what I'm going to call for a minute the hidden communities with inequalities that we're not accessing? And maybe less relevant for this borough, but in a previous borough I worked in, there was a lot of factories, and basically those factory workers didn't access any form of healthcare, and you pretty much had to take it to them, which is what that borough ended up deciding to do, running health checks in the night shift and basically saving people's lives, because people had such terrible readings they had to be sent to the emergency department because they were at risk of dropping dead. These people hadn't accessed primary care for years, partly because of their shifts. But it was a really hidden community that no one had really thought about, possibly doesn't get picked up in a JSNA because it's such a hidden, but I'm just wondering, how do we think about that with integrated neighbourhoods, that's all.
Philippa, I mean, you are reading my mind, actually. Because I was definitely going to touch upon the health inequalities and what we can do to support. And I think our health on the high street is to address just that. And so we have kiosks in various parts of the borough, in our libraries, etc. We have health hubs in some of our shopping centres whereby people can walk in and get their Vital 5 checks done. And that is primarily to target those who cohort of people that we don't normally see or walk into a GP surgery. And I will say, I think the last stats was about 70 to 80% of those who access those were from communities actually that we needed to target. So it is working, and I know recent reports stated that there is some kind of work with the GP, some of the federations, to funnel through some of the information we get from Health on High Street to the GPs, so that we can work better together. So we can talk about how we access Health on High Street much more in this new neighbourhood as well, to address that health inequalities point. Thank you. So I think the last part, go to Nancy.
Thank you. So I've been close to this work for a long time, but it's always really enjoyable every time you re-present it for me to see what's happened next. And I've written about 10 things down saying, oh, what about this, what about this? The theme that my question is, as you take on more stuff, don't forget it's already being done somewhere. There's lots and lots to learn. The LAS stuff that you referenced, Louise, there's some great stuff going on in Bromley, I think, to do with frailty and preventing call-outs. Because, they've gone decaf everywhere, so people aren't getting up in the night to pee in care homes, and they're not falling over. I mean, lots of wonderful things like that. Long-acting antipsychotic injections, there's been a 6-borough piece of work going on that I've been sponsoring in my medical director role, which is a precursor to the INT type thing, so please come for that. There's lots of really interesting thinking going on about the Child's Model for children with neurodiversity. That's happening in Southwark and Lambeth. There's actually quite a lot going on at SEL as well. And primary care, secondary care interface. So that sounds, all right, we know about that. It's all about referrals. Actually, what's coming out of that is some really nice stuff to influence workforce and to influence patients. And we're trying to develop that as a kind of bit of a training guide, a bit of a resource that can be sort of taken to different settings. So lots out there. Come to me, come to whoever you think would help you, because there's, you're going to have to adopt an awful lot of this as we evolve.
And that's an important point, not, learning from the past and learning from who's doing it well and taking as much as you can, because I think what we don't want to do is kind of restart things, or actually we can just grab it from somewhere else. So, I'm not going to go through all the questions as asked. I think our session after the election would be good to be able to really home in on some of the outcomes. Sorry, Maria. We will talk about, I will update you while I'm saying that. So we'll deal with this after the election. But, great work. Thank you. But let's please integrate the work that has been happening with the council, with yourselves and other VCSs also. And let's really set a blueprint for other ICSs around the country, how you can do well, what we can do with neighbourhood work. Okay? Great. Thank you so much. Thank you. And I'm going to go now to item 11, that's Healthy Communities Progress Update, and I'm going to call on Rosie again.
Thank you. Back again. I'm Rosie, Head of Programme Place and Partnerships and Public Health Team, and this is an opportunity to reflect on the Healthy Communities strand of our strategy and implementation. So the Healthy Communities piece is looking at access to good quality homes and streets and environments that promote good health and well-being. And there are 13 actions, not all of which I will mention, but I'll pick out some of the highlights and hopefully inspire you to think well of the work that has been done, because I think there's some fascinating and really impactful things that have been happening. So firstly, to give mention to the work in housing, particularly around damp and mould. I know there's been some new work on data and insights and the triage system to help inform prioritisation based on tenant vulnerability, which has been really great to get moving. And we're seeing an 8% decrease in damp and mould call-outs between 24/5 and 5/6. So that's fascinating. I think housing are intending to look into that a little bit closer and really understand and unpick what's driving that decrease. hopefully for all the right reasons. So thanks to Housing for that. New methods for monitoring air quality employed, including a new role investigating emissions from construction sites. I know that's linked to some exciting work with ARAP and Impact on Urban Health, looking into how we really evaluate that and promote that more widely. We've got 48 households that have accessed housing support through the new co-located service at Camberwell and Bermondsey Family Hub. That co-location piece has been recently discussed at the Health of the Borough event as well, and that's being managed by the Housing, Health and Care Board, so that will continue, but looking very positive. And multi-agency hot weather action plans being developed, so we're all prepared for a hot summer if it comes. On good mental health, so 5 Ways to Wellbeing campaign. It's actually coming to an end now, but has been running through 25-26. Challenge you all to think if you remember the 5 Ways to Wellbeing. So being active, connecting, taking notice, keeping learning and giving. So last point really connects with the voluntary sector as well. So all things that are evidence-based to promote mental well-being. And the next point around the funding differently work, which Community Southwark and United St Saviour's have been working on, really backs up that 5 Ways to Wellbeing campaign. It's also thinking about how to support people with mental health issues as well as preventing mental ill health. 275,000 been awarded to 44 charities supporting wellbeing. That's quite a wide range of interventions that has been involved, but lots of engagement with communities, and I think that is a really nice way to have that first conversation a lot of the time. Just on supporting the VCS, so we have had 47 community researchers trained as part of the SIP, the Southwark Insights and Intelligence Programme, and again another really great way of engaging with our communities as experts in their own rights and able to contribute to driving the insights that are then shared with the system, and I think that some of that work has been very well received so far. We have a new VCS consortium and collaborative commissioning approach being trialled, and £150,000 invested in Southwark-based organisations to develop a trust and health creation partnership and support VCS capacity building. I think there's I'm trying to remember the name of the organisation in Southwark that is supporting SCL on this. I think it's an older people's partnership, but it's just good. Southwark Senior Social Association. Does that sound right? Yes, excellent. So supporting SEL, but also a very local organisation supporting older people. There are a few requests for the board. So in terms of the SIP programme, asking the board to commit to delivering on the solutions that will be identified through the action research projects, which are focusing on council debt, council tax debt and family early help. Second, around the Trust and Health Creation Partnership, so asking the board for advice on how to spread and scale the use of digital impact tool for the voluntary community sector and how it can be embedded in local commissioning processes. Thirdly, an action on a request on air quality, so to consider opportunities for board partners to support community engagement around air quality and to connect the environmental protection team to healthcare organisations that currently collect carbon emission data, so recognising a bit of a disjoint in terms of data there as well. And lastly, on co-located housing and health, so to consider whether additional targeted resource could be allocated to support households with complex needs in a coordinated way, and this will happen through the Housing, Health and Care Board. I think, just lastly, recommendations. So to note that the board notes the progress updates and the outcome measures and requests that have just gone through, And lastly, to identify next steps for board members and lead officers to make further progress.
Great. Go to Akim.
Thank you, Chair, and thank you, Rosie. I'm the sponsor for this theme, so it's right that I say something to open discussions on it. I mean, it's good to note the progress, and I think members of the board would have seen the progress being made from the paper submitted at particularly the action plan. So that's really good to see. Well done to the team for that. A couple of things. One is that the first agenda item we discussed was the proposed or incoming strategy. This is from the existing strategy, so we need to think about what we do, how we don't lose actions as we prepare for the next strategy. And then the second issue is on action 4.9. I've discussed this already with the team. We've been discussing the possibility of having a campaign on damper mold. I mean, it's good to see that damper mold complaints are reducing, but we're still dealing with a significant number. And what we're finding is that there are many situations where if residents had the knowledge about what to do, it wouldn't get as bad as it's gone. We're forbidden to blame lifestyle for damper mold, but in reality, people could make a difference to the to their homes if they were to make some changes in the way that the property operated. So we need to work on that campaign, and that's going to be added to the action plan.
Great, and I'm really happy to see that decrease there, so well done. But yeah, we're really going to drill in what is making it happen, and so we can expand it. Do we have any comments? I'm going to allow for 3 comments here. I think that one thing, what I will say, I mean, this is a lot of work here, a lot of achievements, and so huge thank you to yourselves and your team that have done this. One question I did have is the first one, 4.1, on the anti-poverty plan. Do we have an anti-poverty plan, or is this going to, we don't? Okay. What is it? We need to review this point, whether we are going to push ahead and do an anti-poverty plan, or actually is it going to respond to that?
So I can take that away, I suppose. So there's a number of actions taking place, which we've highlighted there. I suppose my question would be, given one of our earlier conversations about do we need lots of strategies and plans, or do we need to be more coordinated, is do we need a separate anti-poverty plan, or would it be helpful for us to incorporate it into our conversations about the new strategy, neighbourhood health plans? I'm happy to take the conversation either way.
I'm happy to get comments, but I think for me, we know that poverty is the foundation for a lot of issues that our residents face. So it will be good to understand how, as a council, we are dealing with that. But there's a lot of things here. The kind of the funds that we give out to residents, the Southern Energy Savings Scheme. There's a lot of things here that actually speaks to it and responds to it. So whether we draw them out also, and also to kind of, I'll come to you, Jasmine, widen it out as the kind of support system that we have as a council to address poverty, because we know that is one of the biggest things, especially in the cost of living crisis. That's the biggest. So it'd be good for us to kind of understand for ourselves what we're doing to tackle that. I think the question that Hakeem asks about how do we take this for the next strategy, because we don't want to lose it, is a question I'm going to throw back to you to think about, whether we could subsume it into the new strategy, or do we wrap it up now and something that we can take it forward? Yeah, Jasmine, and then we're going to wrap up. Thank you. I'm mindful of time, so I'm going to move on. So if we can think about that, but it would be really good to take out all the work here that responds to the anti-poverty plan and actually anything else that is happening in the wider council to really look in and hone in what we're doing. Okay, great. Thank you.
Thank you, and a big thanks to all of the teams that contributed.
Yeah.
I'm conscious that I'm collating and bringing this to you, but many teams involved.
Yeah.
Thank you.
And again, please extend our thanks to the
We
team.
haven't done enough clapping.
No, we haven't. I just like to say Nancy is my very artistic, artistic companion. Yeah. Okay, so we're going to go now to your favourite part, air quality. And I'm going to ask, is it Andrew? No? Who's going to? Paul's going to be Andrew for today. Paul, you're welcome. Over to you.
So this is about the annual status review for 2024. Just to give some background about the timetable for how the annual status review comes to you. So it's based on calendar years of data. So this is the 2024 calendar year. There's an approval process whereby the GLA and DEFRA have to approve the final draft of our ASR, and that's deadline is 31st of May. Our approval usually arrives from the GLA by August, but sometimes not until September, too late for the November Health and Wellbeing Board publication deadline. So this is why you're now seeing this somewhat later than you may have expected. So there may be updates to what we're doing around air quality and other related issues which will not appear in the report, but I'm happy to answer any questions about those. So the two recommendations are that we note and approve. So this report is not an approved report of the Council until the Health and Wellbeing Board has approved it. It has been provisionally published on the Council website with a disclaimer saying that it's not yet a formal report of the Council. That was done with the then lead member's approval. And the second recommendation is to confirm whether you would like to continue to receive annual status reports for sign-off, and I'm assuming that the alternative to that would be delegation to Cabinet member for them to approve with a subsequent report coming to yourselves. So this report summarises what we've done in 2024. It generally shows that there's been an improvement in air quality, and for the first time all of our sites met the annual objective, the national objective, not the World Health Organization, but the government's objectives, which are a bit more lax than the World Health Organization's. But that needs to be continued for at least 3 years before we can definitely say we don't have a problem with air quality, at least to the national standards. So because we're not yet able to say that, we're still required to have an air quality management area and to produce an air quality action plan to show what we're going to do to improve air quality in Southwark. So my team, the Environmental Protection team, is responsible for air quality projects to improve air quality, raise awareness about air quality and reduce exposure to poor air quality. And that now includes indoor air quality matters, and we're interfacing with the public health programmes on damp and mould, for example. Presently, this was since 2024. So the national limit is 40 micrograms per cubic metre for nitrogen dioxide. That's now been met, but we're aiming for the World Health Organization guidance, which is down to 10 micrograms per cubic metre, which is a much stricter objective standard. The other pollutants that we monitor for are particulate matter, ozone at one location in Elephant Castle, and we also have some responsibility for mercury vapour from the crematorium. Is the only other pollutant, that's probably the one pollutant which is not a greenhouse gas. So there has been a minor rise in ozone pollution since the publication of this report. That's mainly because nitrogen dioxide levels are coming down and the two pollutants interact with each other. So nitrogen dioxide tends to scavenge ozone. So when there's less nitrogen dioxide to scavenge the ozone, then you get more ozone, this sort of photochemical generation of ozone. Particulate matter's also coming down, particularly PM10, and PM 2.5 is staying more or less stable, but there is one component of PM 2.5, so this is the smallest fraction of particulate matter, PM is particulate matter, which appears to be wood burning and appears to be slightly on the increase, and that also generates particulate matter. So that's one of the areas which we're focused on combating. I think those are some headline achievements from the Air Quality Action Plan, which is supporting the annual status review. So
sorry, someone's playing some music. Was it a phone? It's a phone. Okay, carry on.
Thank you, Councillor.
Okay, carry on. Sorry.
Thank you, Councillor. So some headline achievements from 2024. We're in a number of pan-London projects which are coordinated by the GLA across boroughs. So we've been involved in the wood burning campaign in a non-road mobile machinery, that's construction site machinery, which is quite heavily polluting machinery, cranes, dumper trucks, that kind of thing, to check that the standards are being upheld. And there were a number of other projects which are listed in the Air Quality Action Plan, which is appended to the annual status review, which is the report appended to this report. We have 6 automatic monitoring sites in the borough, and you'll see it's paragraph 22. We were expecting a 7th DEFRA site planned for Leighton Square, but that is now not happening. DEFRA have withdrawn their application to do that. But our 6 sites are giving us good coverage. There's also a network of 90 diffusion tubes, monthly average nitrogen dioxide diffusion tubes, which is spread right across the borough at 90 different sites. And there's also 31 school streets in Southwark, which helps reduce vehicle pollution outside school gates and reduces exposure to school children. And the annual summary report was compiled with information from lots of different, other departments because, is there any water? I hope not. Excuse me. It's quite dry, isn't it?
I'm conscious of time. All I want to do is to summarise it. It's not 31 now, it's 32 school streets. And we will be accelerating the rollout of school streets over the next year as well, to cover all the primary schools and then start touching the secondary school, which has a huge impact on air quality reduction for young children. These stats are very, very welcome because the improvement in air quality, and they don't just happen is the result of a lot of what we're doing across the council in terms of not just school streets, modal shift to active travel, the increase in cycling, probably the biggest tree planting scheme in the whole of London. So all of that together will start pushing the air quality down further and further. So these are really welcome figures, but I thought I'd put it in context. I have emailed my team to see how many school streets we're doing next year. I haven't had a response yet. We're just looking at our programme. But sorry, you've stopped talking now. Do you?
No, I think that's lovely. Thank you very much. I think that summarises.
Great, thank you so much. Again, huge well done. I think everyone in Southwark will welcome that news that air quality has improved in the borough. And as you say, it's because there's so many different things that we are doing in various departments to be able to achieve that. So again, thank you for that. I'm very mindful of times. I'm going to go 3, because Nancy, I'm sure you want to say something, because I'll go to Jasmine, Sangita, and Nancy.
Thank you very much for the work on this. It's really awesome. I mean, great work. I did want to just add something. On the school streets, I mean, really great work. However, it's now we're getting to the more difficult schools, which are on junctions, and the lobby, from a lot of businesses and car drivers, they cannot we've had so many lobbies about having to close the streets, even just for 2 hours a day. So I think really, I feel that, yes, rolling out the school streets, but we're going to have to, look at the wider traffic strategy around these schools. I don't think we can carry on picking the schools off because the lobbies are getting, a bit much really. So obviously the amazing work that you do, in raising the culture, changing culture, but I do think we're going to have to start looking at the wider traffic. I'm not going to say LTMs, it's too close to the E word, but I do think we're going to, I said it, I think we're going to have to, look at the wider strategy because, it's getting quite difficult with the last few schools, I guess.
Thank you. Sangeeta?
Huge thanks and well done, Paul, to you and your team. So I chaired the Air Quality Board when I first came to Southwark 5 years ago, and I was just so delighted to see how passionate the team were, so huge well done. It's slow, steady steps. I refer you all back to my Director of Public Health annual report last year, which was on air quality. It's still hugely relevant. Please do have a look. So a lot of work went into that. And back to your questions to the board, I think because this clearly has such an impact on every area of all of our business, my request would be that we do keep bringing it back every year to the Health Wellbeing Board for sign-off. We've got to keep our awareness up. Thank you.
Definitely. I was going to end with definitely bring it back. So that is the decision we've taken. Nancy?
Cause and effect is really important. It needs to be in the news. Is there any way of raising the awareness beyond the annual health report, which I know public health report, which lots of people read, Sangeeta, but not enough?
Quality Delivery Group has recently started bringing in a dedicated member of the comms team to make sure that we are doing comms better, and I think that's one of the things that came out of our benchmarking is that we can blow our own trumpet more. We're doing a lot, and we should make those points. I wonder if I might just briefly respond to Councillor earlier about the school streets. One of the things we've done is where school streets have been found to be extremely difficult to implement, or on main roads or junctions, as you say, is to instead look for local sources of air pollution and attack those. So, for example, trying to put air source heat pumps in schools to replace gas boilers. The other response is about the LTNs. We did have a low emission neighbourhood in Woolworth, which was supported by the Mayor's Air Quality Fund, and I've recently sent up an evaluation report for that, which I believe Councillor Batterson has at the moment. And one of the conclusions from that is that, okay, you can do it very well in small areas, but to make it effective, you need to roll it out across wider areas. That's all.
Great. Thank you. Thank you for your presentation. I think if we can look to put it in Southwark News, not Southwark News, I'm talking about Southwark Live. No, Southwark Live. Yeah, I'll do. Yeah, but Southwark Live. I mean, we've got control of what goes in there. So if we can consider putting that in, it would be really great. Okay. Great. Thank you. So we have item 13. It's the Preventing Suicide in Southwark 23 to 28 progress update for the Health and Wellbeing Board. This is not a presentation, but it's for us to acknowledge the progress made. To provide any comments and to agree the next step that we'll get an update in 18 months' time. I want to take this opportunity for this great piece of work. It's a difficult work. It has to be done. As a local councillor, I hear, unfortunately, of issues like suicide that happens in the community, and we definitely need this strategy. We definitely need to keep on pushing for it. So thank you for this work, and I just commend everyone that's involved in it. So thank you, and we look forward to the 18 months progress update. Great. We are just on time, and I realised actually I didn't do the minutes. Yeah, so can we agree to approve the minutes of the meeting held on 11th of December? Agreed. Excellent. And I think that was there anything else I didn't do?
There's just the action log, but there's no action.
There was no action log. There was an action log. There was no actions to follow up. Outstanding. Thank you for that. But before we end, some of you would have thinking, I'm always looking at Maria, and she would do an impression like, oh, why is that? Because actually this is Maria's last meeting with us. So I'm going to hand over to Maria to tell us why this is so.
Thank you very much. Yes, as you know, I'm becoming very emotional, but I am retiring, and so May is the end. But I would like to thank you very, very, very much for how much I have learned from all of you. It's been fantastic all the number of years, because I have been 12 years a councillor. Not so many health and well-being board, but quite a lot. And yes, I have been very proud to serve the community and to be part of the well-being board and try to influence certain things within the meetings and with the different reports that you have made. So before I become very emotional, thank you very, very, very much. And I see you at some stage or another in the future, because I hope to be continuing to be involved in the council, because if anybody needs me, call on me. I will be able to help. Thank you.
Maria, what can I say? I mean, on behalf of the Health and Wellbeing Board, just a huge thank you for your commitment. You are always at the meeting. You've always got a really strong question to ask. But being a friend, Maria's in opposition. She's my opposition right now. But she is the most, hardworking, courageous, just works so well with me, and she understands, and there's times when there's something happening politically, but Maria will always take time to listen, always take time to address me and contact me about it. So I want to thank you for being a great opponent. An opponent, but now you're a friend. Thank you so much for all that you do. Thank you for representing your community. I know the Latin American community would not be where they are without your voice. So I just want to say a huge thank you. And I hope you are still working with us post-May. So again, can we just thank you.
Thank you so much.
Thank you. And I want to thank everyone here. We are going into the election in May, so there may be some changes. I hope to be back. I hope Jasmine will be back. But thank you for all the work that you do in the community also. Thank you.